Let me ask Dr. Wiechers, I noticed that you are on the faculty at Yale, so you're familiar with our VA facility in Connecticut, and as you know, Secretary Collins has repeatedly stated that access to VA care has not been affected by staffing reductions, but the VA's own data, in my view, tells a different story. Wait times for new mental health appointments have increased sharply since January in my home state, Connecticut. For example, the most recent data shows the current wait time for a new patient mental health appointment at the Orange VA clinic in Connecticut, an outpatient facility specializing in mental health, is 208 days, nearly 6 months. Let me ask you, given these kinds of wait times, how does the VA plan to prevent over-reliance on medication when veterans can't access these timely appointments? And what steps are necessary to address this issue?
Thank you for the question, Senator. I agree that access to timely mental health care is one of our top priorities. We continue to actively be recruiting and hiring mental health providers across the system. We are working to address the access challenges that you have noted, and it does vary from facility to facility. So acknowledge that there are differences based on location, but we're doing work now to identify areas of ways we can improve our efficiencies so that our workflow and our ability to see patients and get them
You
access
don't
quickly.
dispute the data showing those wait times?
I acknowledge that there are wait times at some facilities that are beyond what our expectation and standards
I've also heard credible reports that some VA psychologists are being instructed to cap the number of sessions they can offer patients, even when, in their professional judgments, additional sessions are clinically necessary. I don't know how you justify that kind of practice.
There is no cap on the number of psychotherapy appointments that a veteran can have. There's no national policy.
So
that wouldn't be.
You dispute that there are any caps that psychologists have been instructed to impose?
We support the implementation of evidence-based psychotherapies. Many of those evidence-based psychotherapies are a course of treatment that occurs sometimes 8 to 12 treatments, sometimes 12 to 20 treatments. The individual provider working with that veteran is the one who's determining that course of treatment and when it's appropriate to complete that work. But there is no cap set. There is no policy indicating a cap in the number of treatments available. It is a decision.
So the answer to my question is yes, you dispute that any instructions have been provided that there should be a cap imposed by
There is
psychologists.
no national policy instructing to have a
well,
cap in
are
psychotherapy.
psychologists ever told they have to impose caps?
I can't speak to what every individual psychotherapist across the country has been told by someone, but I can say that we don't have a policy that states that,
Well,
and that I wouldn't support it.
I will just tell you, I'm going to cut through the verbiage in the interest of time. We've been told by multiple sources that caps have been imposed on psychologists. So if you're not hearing it, I think the VA leadership needs to do a better job of listening to the psychologists and others who are actually providing care. In the interest of time, I'm going to yield.